Welcome to Demystifying Medicine. In today's episode, we are talking about food addiction. The issue of food addiction has gained significant attention among healthcare providers worldwide. Individuals that are dealing with food addiction typically find themselves drawn to foods that are rich in sugar, fat, and salt. Over the years, there has been plenty of evidence proving that the consumption of these foods can actually activate the same reward and pleasure centers in the brain as highly addictive drugs like cocaine and heroin. The pattern behind these addictions are all very similar. Some examples include consuming more of the substance than intended over a longer period of time, preoccupation with the substance, craving or strong urges to use the substance, and continued consumption despite knowledge of adverse effects. In the case of food addiction, some examples of adverse effects that may be ignored are weight gain, which may end up affecting physical health. Eating these types of foods that are rich in sugar, fat, and salt can raise the amount of dopamine that is in your brain's reward pathway, and this results in feeling pleasure in the body. This means that your body will eventually crave this feeling, and you will quickly feel the need to eat again. These reward signals that your body feels after eating these foods are actually able to override the signals of fullness and satisfaction. This means you might continue to eat even though you're no longer hungry and your stomach is already really full. All the information we have discussed can be deemed as compulsive overeating, which is categorized as behavioral addiction. A behavioral addiction means that an individual is preoccupied or becomes fixated with a certain behavior that triggers intense pleasure in the body. This addiction may progress to a point where you develop a tolerance to food altogether, which means that an individual will have to continuously increase the amounts of food being consumed in order to reach that dopamine rush that the body is craving. Food addiction can be a difficult disorder to diagnose, as the signs and symptoms can be overlooked by many physicians, along with family and friends. Specific symptoms of food addiction can include eating when you are no longer hungry, eating to the point where you feel sick, and doing whatever you can to obtain foods that aren't easily available. Food addiction is typically coupled with other mental health conditions, such as depression, anxiety, and self-isolation. Eating excessive amounts of food is most commonly seen as an emotional coping strategy for individuals who are going through a tough time, whether that be a loss of a loved one or other difficult personal situations. It is often seen that the individual who is overeating is doing so to try to reduce the negative feelings that they're feeling in their life at that time. It has been found that food addiction has a strong relationship with genetics, along with psychological and social factors. There's a high percentage of food addicts who have at least one blood-related family member who also has some sort of addiction, whether that be food as well, or alcohol, drugs, etc. Individuals with food addiction are likely to have a specific genetic dopamine markers that are found to have a connection with appetite and addiction in general. Apart from this, as previously mentioned, individuals may help develop a food addiction after traumatic life events like abuse, grief, or stress. The concept of food addiction has sparked controversy, accompanied by various stigmas aimed at individuals involved in this issue. Among these stigmas, two primary types stand out: self-stigma and externalized stigma. First, let's start by defining self-stigma. Self-stigma revolves around how individuals dealing with food addiction internalize societal perceptions about obesity and food-related addictions. These impressions frequently result in stereotypes, labeling affected individuals as lazy. Consequently, those struggling with food addiction may experience emotions like shame, guilt, and isolation from society. This self-stigmatization can increase the risk of mental health disorders, such as depression, anxiety, and a decline in self-esteem. Externalized stigma, on the other hand, focuses on how the broader public perceives food addiction. It is frequently considered as a matter of personal choice rather than a medical condition, which often results in individuals facing food addiction and encountering negative attitudes and discrimination from society. According to an article referenced from National Library of Medicine, a study indicates that individuals termed as obese food addicts could confront stigmatization compared to those labeled solely as obese or food addicts. This externalized stigma associated with food addiction might pose further difficulties for those seeking support and understanding for their struggles with food addiction. As you can see, food addiction is a very difficult disorder that is hard to overcome. However, addressing the challenge of food addiction involves a comprehensive and personalized approach to treatment. Cognitive behavioral therapy, or CBT, is a key part of this approach. It helps individuals understand and change their eating habits. CBT is a form of therapy that focuses on identifying dysfunctional behaviors, emotions, and thought, which in this case would be food addiction. It is widely known throughout mental health initiatives. Within CBT, individuals work with a therapist to become aware of these negative thoughts and help change these patterns, leading to more healthier ways of thinking and behaving. Additionally, support groups and counseling play a vital role, providing a support space for sharing experiences and receiving personalized advice. Learning about healthier food choices is crucial, and nutritional counseling guides individuals in this journey. Lifestyle changes such as incorporating regular exercise and stress relief are like building blocks for a stronger and more healthier relationship with yourself and with other individuals of food addiction. In our video today, we touched on the idea of food addiction, the stigmas related to it, and the current treatments that are being used. Food addiction is extremely prevalent in our society, and it is important to be aware in case yourself or someone you know is going through this challenge.